Hello and welcome to our discussion on data recovery and disaster management, disaster recovery, cybersecurity. Up until this point, we've talked quite a bit about the electronic health records, some of the IT processes and systems that are in place. Today, we're going to discuss a little bit around the downtime, disaster recovery and disaster planning and what that means. And then we're going to go into some discussion. Actually, we're going to look at some external resources around cybersecurity that I've posted on the site for you to review. So without further ado, we're going to discuss this. And the first thing about disaster recovery is we really need to talk about why we have that. Now, obviously, it's good process to have the ability to recover data that you've lost or to prepare for a natural disaster so that you do have the uptime capability. And actually the CFR mandates that the healthcare operations of the facility must be able to continue during a disaster or during an emergency or have these plans in place. And ideally these data backup plans will be electronic, and that the disaster recovery plans and procedures make it as easily as possible to restore data. And we're really talking about this data that's not just PHI, but also organizational data. They also, it's part of HIPAA, but the testing plans are recommended but are not required under HIPAA. Now, as far as risk management, the first thing that we kind of have to look at is the risk management. And really that risk management, again, that's that sound business philosophy of whatever industry that you're in. But it really comes down to analysis, management, and then evaluating these risks. So the analysis is required by the CFR. The healthcare organizations are required to conduct that. An accurate and thorough assessment of the potential risks and vulnerabilities, the confidentiality, integrity, and availability of electronic protected health information held by the covered entity or by the business associate. Now, something we haven't really talked about is business associate. A business associate would be like a vendor or a consulting company that comes in. It could be another facility, either inside or actually outside of that organization that they're contracting to do work, whether it be a lab or whether it be other ancillary services, depending upon the size of the organization. But those business associates also required to comply to the HIPAA regulations and the regulations around PHI. During that analysis that is required, we then come to a risk assessment. Now, it's impossible to identify every single threat, but it does mandate that they do take into account as many as they can really kind of perceive. And some of those risks could be environmental, such as a hurricane or a fire. It could be infrastructure, like electrical downtime where electricity is cut off. So we need to be prepared for these different types of emergencies, including the ones where maybe the server crashes and we lose data because the internal operations are somehow compromised. There's also disaster recovery from if somebody were to take data. If the backup site, if somebody takes the data out of the facility and it's stored in a backup site and that data goes missing, or it's on a laptop or a thumb drive and the associate misses that. So, and we also have to have some sort of physical security as well, so that you have to have a keypad or a key. You have to somehow have some way of accessing the data center or the data in the hospital from a physical security standpoint. And again, these also extend out to business associates as well. So part of the risk management, they have to be to a reasonable and appropriate level. And really, those security measures that they're implementing, that reasonable and appropriate level, does provide some flexibility for the healthcare organization to really kind of figure out what they need more specific, and hopefully to make a reasonable and appropriate effort to manage those risks. So there is a little bit of play in the word as far as reasonable and appropriate in the judgment of the healthcare organization. After that, they have to do recurring risk evaluations. And this is not just the actual doing of these risk evaluations, but also the standards and the operational environmental changes that affect the covered entity. Do they have the policy and procedures in place? So to comply with this regulation, they must determine what constitutes those environmental or operational changes that do potentially affect the risk. And that could be the installation of a new version of the EHR or an upgrade, installation of other ancillary services, in addition to additional medical specialties to a provider's practice, or an upgrade of a computer or of network hardware. And of course, one of the risk evaluations is if we put a data recovery plan in place, that movement to that new data recovery plan is a risk. So until that has been vetted out and is showing functional. Recovery and disaster recovery and business continuity. Now, this is not, again, solely on healthcare IT. This is any industry should have a disaster recovery plan. This is just good business practice. But when you're looking at disaster recovery, it's not just a replication of the data. And it's often thought of that, especially in healthcare IT, and it's often thought of some sort of a physical backup where things are backed up and then they're taken off site and they're stored for a couple of weeks so that they can then be pulled out of that archive in the case of some sort of an emergency. But some of these systems do need to be replicated, and most of these are the ones that are really key and required to take care of our patient population. So those would be like electronic medical records, the radiology information systems, pharmacy, PIS, and other tier 1 applications that have much more aggressive uptime requirements. The amount of time that somebody can be down from downtime, then they have to go back into and actually put the information back into the system from whenever they've retrieved that information. This business continuity, the business recovery, the disaster recovery, the contingency plans, again, not just the technical, but also things like electrical outages, water from floods, HVAC, or any kind of internal fire suppression that covers the data center, as well as that security breaches of the perimeter or the grounds or the actual facility. Not as big of a issue now, it seems, the physical security of data, as much as it is the cyber security of data. Nowadays, it seems like the attacks that we get are not somebody leaving a briefcase in a car that then gets taken, as much as somebody phishing or breaking in or hacking into a system to get PHI. Disaster recovery plan questions is, at the time of the outage, what applications do you prioritize? As we mentioned, patient care would be probably the primary prioritization. What is the tolerable RPO or RTO requirements for my critical applications? We don't just want, we want to recover from a time or from a point. So, and we'll get into those in just a moment. How do I back up my data today? Is it tape, storage area network, cloud? Is the backup network segmented to be prepared for failure? One of the things that we don't want to have is something that has a single point of failure. If there is a single point of failure, then that means at that point of failure, nothing works. So redundancy is going to be key to make sure, and segmentation to make sure that that doesn't happen. Again, do the applications require replication rather than just backup? Do we have to actually replicate the application itself? We could save the data, but if we don't have the application because it was corrupted, are we able to use that data? The consistent processes around change management to ensure testing and rollback scenarios. Sometimes what we look at is we make a change and then we roll back because there's an issue, we roll back to a previous installation of something. And you'll see that from time to time with like Windows or Microsoft Office, where it asks for a reset point. So when you do an update to Windows, it's not working, can you roll back to a previous state? And what does the non-healthcare IT staff do at the time of a disaster to keep the business running? And that would be basically anybody who's not in healthcare IT. So the clinicians, what are they doing to keep the business running? What are the people in registration? people in billing. What are they doing to help keep the organization running? So some disaster recovery terms that you're going to hear: DR, disaster recovery; HA, high availability; BC is going to be an important one. That's business continuity, and that's the defined set of planning related to activities that are intended to ensure that the organization's critical business functions continue to operate. That's very key. Those words are very key in healthcare because patients don't stop coming in. Patients don't stop being sick just because there's downtime. Business impact analysis, recovery point objective, and a recovery time objective. So what we're thinking of is which files, which programs do we have to have a recovery point? So at the age of the files that must be recovered from the backup, or the duration of time of service level which a business process must be restored after disaster. So is there a time objective that's associated with that? Some systems are much more critical than others and require a much smaller RTO. We're also looking at disaster avoidance, and this is part of that part of the plan of going through and making sure that we're doing our risk analysis and assessments, disaster recovery during disaster, as well as business continuity during a disaster. You want to make sure that that you're doing the things that you need to during the disaster while everyone's taking care of their patients. And of course, post-disaster, of how much time does it take to get back to quote-unquote normal operations. So really there's 5 phases to a disaster recovery and business continuity plan in healthcare specifically, and we're going to go through a few of those. Data security and disaster recovery, there could be a whole course on this material. So we're really getting a snippet. I'm not expecting for you guys to come up with a disaster recovery plan, although that would be kind of cool. But the reality is do you have an understanding of kind of what that happens? Because at some point in time in your career, you're going to be probably faced with a situation where there is a disaster, and you're going to be a part of this plan. So that's why we kind of touch base on it so that you have an idea of what's going on. Again, this is not information that's in the book. One of the reasons we don't have any readings this week is because, quite frankly, I think there's 1 or 2 sentences on cybersecurity or on disaster planning, and really very little else in the book. But phase 1, we're going to talk about data collection and technical options. So we're going to collect and review the application portfolio. What do we have in our portfolio of applications and the existing infrastructure and architectures? We're going to review any major application changes and then identify the high availability options to support RTO and RPO. So if we're talking about something that needs high availability, then of course it's going to cost much more money. The recovery point, we're looking at under 5 minutes, and the recovery time to be whole would be less than 24 hours. And when we're looking at the basic recovery service versus continuous availability service, this is definitely a cost thing. So as your need for more on time, more uptime increases, the amount the solution cost is also going to increase. Phase 2, after we've determined the RPOs and RTOs, we estimate the equipment and resource cost. And here's just a table that talks about recovery time objective and recovery point objective. If we're looking for component failure versus facility disaster in under two hours, regional disaster would be under 2 weeks, such as a flood or a hurricane going through, and we're really looking for no loss of any information. Whereas if we go through to our tier 3, which would be like a learning management system or some of the not as business crucial systems in that tier 3, then it doesn't matter as much how long it takes to recover, just that we do eventually. And of course, during our phase 2 of this, is we're looking at the estimated timeline for implementing these solutions as well as cost, and potentially utilizing the cloud. Now, with the cloud strategy, the backup as a service, and there's lots of companies out there that provide this, is that they're really, depending upon what your needs are providing things that are either a once in a while backup to almost a continuous backup. And really, when we're talking about something like that, it's very expensive to have that best RTO, RPO. But for some tiered applications, especially the patient-specific ones, it may be worth the money to do that, to have that high uptime, especially if you're in a situation where you are in Houston, or you're someplace that is highly affected, New Orleans, any place really along the Gulf or along the coasts with hurricanes, tornadoes coming through, Missouri, Kansas. You may want to have some of this higher uptime and higher cost recovery capability. Phase 3, we have to design the infrastructures for redundancy to support those application tiers we just talked about. Network services, the file services, protocols, authentication, and more technical services. Design storage for the logs of virtualization, what things we're going to store on-site versus off-site, whether we're going to use the cloud, ensure that our current systems support disaster recovery, and if they don't, what do we need to do? Client services, the VPN, antivirus, patching, app distribution. Those are all things that will help with some of the softer disaster recovery in the event of like cyber attacks or what have you. And then the last 2 phases is develop some sort of a disaster recovery plan, which would then dovetail into phase 5, which would be develop a business continuity plan. And of course, those will be something you would test and renew on a annual basis. Kind of a lesson learned, it's ironic that a few years ago, this is back in 2010, FEMA actually did have an issue where the equipment failed, and the server just went down, but they were able to save the data. However, they didn't save the software necessary to read the data, so they had all this data. And the funny thing is that the data that was lost, or the access to the data, because the data was still present, it was just the access was lost, included historical data on lessons learned from FEMA's participation in past disasters and best practices. So they followed up with that incident by implementing a data archiving and recovery mechanism. It had been planning at the time of the disaster and published lessons learned from its own disaster. It's so funny that we can put together as a healthcare organization, or as really stewards of the public health of our constituents' health, that we put together these plans and we decide not to implement them because of budgetary reasons, and then something hits the fan, and we're like, we had the plan in place, all we had to do was execute it, but because of budgetary reasons or whatever reason, we decided not to, and now we're so much worse off because we chose not to. So I would encourage you that if you are in that area, that disaster recovery and cybersecurity are certainly areas that you definitely need to review and look at. Just a reminder, please review this lecture and the assigned articles, review the video. Cybersecurity is really going to be covered in the articles. There's also an articles video that I've put together. So there is a number of wonderful articles on cybersecurity, particularly pertaining to healthcare. And there's a video. It's actually the CMO of an Israeli hospital. The first minute or so is just his credentials of how awesome he is. But all those issues actually resonate today, even though it was 2017. Again, the book is not going to assist us with cybersecurity or disaster recovery, data recovery. It's just not a topic that they cover, but it's something that I think is extremely important, which is why it's been included in this course. This is going to be a fairly light week for you. Read through the articles, watch the video, watch this lecture. I think that maybe you have an hour and a half of actual study time to do, and then you have your discussion and of course your position paper. But that's all we have scheduled for this week, and then next week we'll move into a different topic. Please, as always, feel free to send me an email or shout out on the learning management system. And thank you very much again for your time. Have a great weekend.